Hello friends and welcome back to my channel. In this video we are going to talk about some of the atypical questions, some twisted questions by the examiner or high yield question from the point of view of the examiner, and some of the things which you forget easily or some weak portions. So the best way is to cover the all of the videos from my channel. It will make sure that you already get 90% and above marks already in the KROK exam, because I have talked about the concept as well as I have covered the main questions highlighting for the particular topic. So your concepts will build up very well after covering all of the videos from my channel, and the best way is to cover all the videos and then get back to these videos for the high yield, or if you want to score like above 95%. Here carefully, what I'm saying is, I'm not saying that this video will take you above 95%. I'm saying is, if your goal is above 95, then you can watch this video in order to cover your weaker portions and the easiest made mistakes which we forget sometimes. So the best way is to cover all the videos and then get back or start with this portion. So this video and any video which will be posted after this video will make sure that you cover all the weaker topics, and this video also contains some of the mistakes which I was doing in the test center last time when I was attempting test centers. However, this time I am not getting enough time because I'm making videos for you, so I'm not getting any time to cover the test center questions right now. If you are getting new question in the test center, feel free to tell me in the comment box. And one more thing I wanted to highlight is that your grade in exam will not be affected by the new atypical questions given by the examiner, because you will be already building up concepts through my videos, and it will cover your main portions, or for the new portions which the examiner can twist new questions to you, it will cover all of them. The main thing is the marks, if your marks are getting deducted in the final score, so the reason most probably will be some questions or some topics which we know already and then we marked incorrect. So this is the main reason that your score may reduce sometimes. However, I'm covering everything, I'm here for you, no problem at all. The main thing to highlight is this video should be best watched after covering all of the topics from the channel, and then you can watch this video. So let's start with today's video. One more thing, today's Tuesday. I hope nothing is disturbing you from the study sessions. If there is something which disturbs you, like brain saturation or any problem, any other personal problems which you are facing in the study sessions, so if there is something which disturbs you, let me know in the comments. I'll reach personally to you, and I have made a lot of techniques to solve the problem related to med students, because I'm myself a med student, so problems were there a lot of times, and I made quick solutions to relax yourself, to calm down your brain, to reduce the brain saturations from the study sessions. So let me know in the comments. I'll reach out personally to you if there is something which is disturbing you from your study sessions, because you have some few days left in the KROK exam. Some 9-10 days are left in the exam, and this is the time you need to focus very well and need to stay good and healthy mood. And so let me know in the comments if something is taking you away from your study sessions. You are just one call away from me and I'll give you instant solutions. So let's start with today's video. I hope you will enjoy the video. I'll be doing faster revision because we have lesser time left. So let's start. So first is a case over reactive polyarthritis. So remember, after reactive arthritis, you have studied in my videos already. So now is the case of polyarthritis. Sir, what is the hallmark finding here? Sir, rheumatoid factor is negative. So you already rule out the rheumatoid arthritis. Uric acids are high. Let's see how many uric acids are given. I promised you that I'll give you the uric acid values in some corner again. So men should be 210 to 420 micromole per liter. In women should be 150 to 350 micromole per liter. In children should be 120 to 320 micromole per liter. So as you see that uric acids I wrote with this question because it's important to understand the levels of uric acids in this question itself, that 375 uric acids are given here, which is normal, so there is no pathology related to uric acid levels. What is given here is pain in the lower back, left knee and ankle joints, and this is the profile for reactive arthritis or reactive polyarthritis. Main thing here which you have seen in the video itself, chlamydia detected in the urethral swab. So this is a infection or reactive polyarthritis case. So the infection, chlamydia infection, provoked the reactive polyarthritis. Next is a case of congenital kidney disease, which is structural functional abnormalities of the kidneys that are present at the birth. So during regular examination, 2-year-old baby enlarged left kidney, painless on palpation, right kidney is undetectable on palpation, no contrast over the right. Why there is no contrast on the right? Because the right kidney is not has been formed, right? The congenital kidney anomaly this is the case of. And why the left kidney is enlarged? Because the left kidney is trying to compensate. Only one kidney is present in the baby, so the left kidney has enlarged its size in order to filter the patient well or the newborn very well. So the left kidney is trying to compensate, however right kidney is not formed there. Cystoscopy detected hemitropy of the urinary bladder trigon of the right urethral orifice is not detected. Sir, because in the right portion nothing has been formed yet, it's the congenital anomaly, so agenesis of the right kidney. Let's see one more time about the nephro investigation system. You can see this same image in the nephro part, or let's say the management portion or investigation portion as well. But let's see them one more time here. That double pileocalcial system, when given, asked by the examiner, then you will do excretory urography. If the contrast starts to flow out or leak out, it means there is double pileocalcial system. Or when you will see two ureters are detected, two drainage are detected in the question, so you will do excretory urography. When they are asking about the cause of UTI, then you will do micturating cystourethropy, which will shows the urinary reflex, the backflow of the urine, which will show very well. Renal tumor, CT. Then when there is any trauma related to the bladder, then you will do R of the trauma word highlights what? Retrograde cystourethropy. Let's see next is the case of subungual paramecium. So first of all, let's see on the definition on the top part, that it is an infection that occur under the nail after a trauma. So let's see about the patient. So the boy having foreign body removed under his nail, 3 days later sharp throbbing pain, distal phalanx which intensifies when pressed, hyperemia is there, temperature is there, nail plate discoloration. So sir, this is the case of subungual paramecium, that the boy had a foreign body under his nail and 3 days later he developed the symptoms, which are sharp throbbing pain, distal phalanx, hyperemia, and temperatures are given in the question, which is the profile related to fever and all related to subungual paramecium. So foreign body under the nail, subungual paramecium. Next is the case over polyarthritis nodosa. So remember, on the top block I have written the definition also, just to remember that polyarthritis nodosa is the systemic vasculitis, affects the medium sized arteries, sir. Immune system attack on medium sized arteries. Our own body start to attack the medium sized arteries. So what are the medium sized arteries, sir? Medium sized artery, for example, kidney have a medium sized arteries. So small arteries, sir, I have the small artery. So what we are going to see in the question is medium sized artery problem. Let's hear it from the patient. 39-year-old patient, man developed surgery, acute cholecystitis. Man went for surgery for acute cholecystitis, transferred to the therapy department, BP severely high, protein excretion with urine. Sir, what the question is trying to highlight here? Protein excretion with urine means a renal damage is there, right? The question will not give you directly about the renal system, but they will highlight something, that problem with the kidney. So you have to understand that there is renal artery is involved over there. So the protein excretion, the proteinuria you have got, persistent fever resistant to antibiotic therapy, 10 days after treatment developed asphyxia attack and difficult expiration. Later arthralgia, erythematous skin lesion and eosinophils are given 18 in the question. So this is something you have I have highlighted it very well so that you remember that when eosinophils are given 18 in the question in the blood, so you have to mark polyarthritis nodosa, sir, which is medium size artery disease. Proteinuria will be highlighted in the question, which shows the renal damage over there. Sarcoidosis we have talked about. What we see in the sarcoidosis, sir, non-caseous granuloma, epithelial cells without caseous necrosis. There is another video over it. Next is about the post-abortion metroendometriosis, and you can cover it in another portion as well, but let's see one more time because it's important. I covered it in obs and gynae as well. 25-year-old woman, 37 degrees pain in lower abdominal, vaginal discharge 3 days ago, artificial abortion. Objectively, cervix is clean, uterus is slightly enlarged on perforation, uterine appendages can be detected, fornices are deep and painless, and sanguinopurulent discharges. So blood and pus is there. So infection, how the infection affected is, sir, she had an artificial abortion. After the case of artificial abortion, she got the endometriosis. So no one notices the endometriosis. Maybe the patient did not go to doctor when the stage was until the endometriosis. So what happened here is the infection moved to the metro layer as well, the muscular layer of the uterus as well. So from the endometrium, the infection has already spread it to the myometrium, and this is the case of post-abortal metroendometriosis. So remember about it. I have covered all of such questions in the obs and gynae part as well. Let's go next. Next is manganese. About when the question says fast mask like face, so such muscle hyperthesia and forced laughter. So forced laughter is caused by what? Manganese poisoning. Next is about the case over collapse. So remember, a 14-year girl was fainted during the meeting. So a lot of time this such similar profile will be given for the collapse. The girl was fainted and students were assembling in the assembly, and some students were taking the pledge in the assembly, so they got fainted. So in the cases of collapse, most of the time you will get diastolic BP very low, even lower than the shock. Even it can reach up to 25 as well. So see, a day before she had headache, pale skin, limp, cold and shallow breathing, heart sound muffled. So remember about the meningeal syndrome is negative, so we are not suspecting about anything about the meningitis or about the subarachnoid hemorrhage would have occurred. Yeah. The case is over collapse. Remember, when such profile is given, that someone was doing this and fainted during this and this, someone was performing their daily routine task and fainted like that, suddenly meet the unconsciousness. So remember, the case is over collapse. Next is the case over the pertussis. So 5-year-old boy has a attack, spasmodic attack, sir, cuff attack with neck vein swollen and edematous face. Sir, this much worse case of the cuff attack you will see in the cases of pertussis. The name itself suggests the whooping cough. However, you can read the whole profile of the question. Next is 8th. Our patient is 48-year-old and his work is with the treat gardeners with the orophosphorus pesticide. So sir, remember, in the cases of orophosphorus pesticide, they are cholinesterase inhibitors. So what they will do is they will decrease the cholinesterase level. This is the direct question. You can read the whole profile, that organophosphorus pesticides will do what? They will decrease the cholinesterase level in the patient. Next is our question is given, question number 9. So age group in some district is 0 to 14. Age group in some of the district of Ukraine is 50 plus. The ages are given, sir. So age group 0 to, for example, as you can suppose with me that there is a district Kiev and there is a district Darnitsa in the Ukraine. So in the district Kiev, there are more population of the young person and lesser population of the older people. In the district Darnitsa or Lviv, in other region, there is older population is high and the younger population is less. So our question says age given is 0 to 18%, 31% population. So young age is 31% population, old age is at just 20%. So the expensive, this is a case of expensive population, that the chart of the population or the visuals or visual chart of the population is expendable, because new population is 31 and old is just 20. So older population will pass away and new one population will expand the chart of the age evolution. So remember about this case. Such case is the example of expendable population or expensive, they say in the exam. Synestopathy we have done already. Another case is 62-year-old patient undergoes treatment for the bilateral gonoarthritis, has been taking diclofenac sodium for 2 years. And so sir, when somebody is taking NSAIDs, when somebody is using NSAIDs for 2 years, this is not use, this is abuse, sir. You cannot take NSAIDs for longer time. So what they will do, sir, they will cause problems with the kidney or nephro system. So what she is facing is, during the last 6 months her BP got increased. So also highlights about the kidney system, her knee x-ray shows this and this. So urinalysis, so in urine there is a lot of things are there to note, that specific gravity is reduced, glucose is negative, cyst is there, leukocytes are there, erythrocytes are there. So what happened in the patient? When she is abusing NSAIDs, what will happen? Damage with the renal tube. So prolonged use of NSAIDs or NSAID abuse will cause the damage to the renal tube or cause tubulointerstitial nephritis. So remember about this case, very important question, one of the highlighted mistake which me and my friends were marking incorrect for very long time and a lot of times. Next is the case, a woman with infertility, irregular cycle, oligomenorrhea, height is 160, weight is this, growth of hairs on the face and thigh, enlarged dense ovaries, this and this centimeter in size. So when the size of ovaries is given, sir, what has happened in the ovaries? Sir, cyst is more common. You told us in the gyno part that cyst formation is very common, sir. It can occur at any time. Cysts, when dense elastic cysts are there, so it will be sclerocystic ovary syndrome. So it is also an important question for the KROK examiner, that when size is given, they find what? Enlarged dense ovaries and some formations inside the ovary, size this and this. So remember about the sclerocystic ovarian syndrome. Our next patient is 52-year-old. He had an acute onset of the disease, overexposure to cold, occurred 3 weeks ago. So a cough, high temperature, chest pain on the right, dyspnea, tachycardia, BP is severely low, respiration is high, acrocyanosis is observed because of severe infection. Acrocyanosis. So right side of the chest, legs behind. So there is severe infection, and infection has caused something with the patient, due to which her or him is having acrocyanosis and lower BP and deterioration of the condition. Sir, let's get to the point. Right side of the chest, legs behind during the breathing, and pulmonary dullness on the right. Dullness shows what? There is some fluid over there, fluid in the pleural cavity, right? And no breathing on the right because there is atelectasis or there is lung collapse over there. X-ray on the right shows a shadow with the fuzzy margins, upper margin to the level of rib 2. Sir, if the fluid is filled up to the rib 2 level, do you think it can be caused by abscess? Sir, yes, in some cases. Unfortunately, yes, in some cases abscess can be severe as well, but in this case you have to remember, sir, when the case is over 90% of neutrophils, which highlights the bacterial infection. So please remember, do not mark abscess in this question. You have to go with the pleural empyema. So sir, remember once again, X-ray finding in the question says are shadow means opacity, which highlights some abnormality in the lung, which fuzzy margins. Although in the abscess, margins are most probably clear. Abscess is what? It's a fluid filled cavity. So margins should be clear and a little bit defined in the cases of abscess. Here the question highlights about the fudgy margins. So the liquid is a lot over there, so up to the level of rib 2. So you are going with the pleural empyema. All right. Next is the question over a port crane operator has the dizziness, nausea, feeling of pressure in the eardrum. Sir, when pressure on the eardrum is there, this is caused by infrasound. You have to remember it. Next is acute bronchiolitis. So let's see the hallmark finding in bronchiolitis. Me and my friends were marking it incorrect for a lot of times. So first of all, it's a look at under the word. So it's a lower tract infection, lower respiratory tract infection, which will be seen in infants first of all. So this is only one type of questions, two type of question I'm covering here. So lower respiratory tract infection seen in infants under 2 years. So in the question history will be given 4 months old, 8 months old. So very small infant. So auscultation will findings what we are going to see in the cases of bronchiolitis. What is typical or hallmark findings, sir? So auscultation will detect dry wheezes plus scattered fine vesicular crackles. Any of the word will be given to you in the question. We know both of them from my other videos that what do they means. So dry wheezes, scattered fine vesicular crackles are seen in the cases of acute bronchiolitis. Let's see our infant. He's 4 month old, hallmark finding. So 37-year-old, cough, acute onset, dyspnea of 3 days, tympanic sound over the lungs, which means some air is also over there, wet fine bubbling and sibilant wheezes during exhalation. So remember about this case, this is the auscultation finding in this case are hallmark finding for acute bronchiolitis, which are wet fine bubbling, which is fluid in the airways, and sibilant wheezes during exhalation because of narrowing in the bronchioles. So in the cases of infants, the bronchioles are very small in the size, so it will be very fast pathogenesis for this, that wheezing during exhalation due to narrow bronchioles. See our next patient. Our next patient says that against the background of fever and 2-year-old boy with the acute respiratory viral disease developed tonic-clonic seizures with the loss of consciousness. Attack lasted 3 minutes. After attack he is conscious and sleepy. So sir, remember when in the question you are given with the tonic clonic seizures, so you have to mark the febrile seizure as an answer. So you have to remember about it, that the other options will be given this seizure, that seizure, but remember only one case about this type. So the attack in the cases of febrile seizure is, the concept behind the febrile seizure is they last only 3 to 5 minutes, they last for shorter periods, sir. This is the hallmark finding over here. So the attack lasted 3 minutes, so this is something hallmark finding with the febrile seizure. Which nature is having in the febrile seizure here in this patient? Tonic clonic nature, sir. So next is the question over 46-year-old having pain attack in the right lumbar area, irradiate to the lower abdomen. Sir, remember for KROK questions, whenever the pain is radiating from the right ureter to inguinal region, right iliac to inguinal region, or right pelvic, or whatever is given, when there is radiating pain, remember to mark about the renal calculus. Such pain attack, pain can be there in other pathologies as well, pain can radiate as well in other pathologies, sir, but the pain attack, the attack of pain is given by renal colic or renal stones or renal calculus. Ultrasound findings are also here, so you can also make some sense with ultrasound findings. X-ray shows no pathology. Ultrasound shows hyperechogenic growth with 1.5 centimeter reflect sound waves in the enlarged renal pelvis. So they give the 1.5 centimeter. So what could be this, sir? We suspect the renal calculus. Next is you see this question a lot of times. So positive Wassermann reaction. So there will be this is the case of secondary latent syphilis. So what will be the pregnant woman tactics, and after the doctor's tactics for the pregnant woman who got diagnosed with the syphilis? Sir, first prescribe the antisyphilitic therapy, then terminate the pregnancy. So the option is artificial termination of the pregnancy after antisyphilitic therapy. We can mark this question wrong very well, but please remember that artificial termination of the pregnancy after antisyphilitic therapy. All right. Multiple sclerosis I have covered in another video. Hallmark finding here are ataxia and horizontal nystagmus. You can read the whole profile. Next is, sir, anthrax. When in the cases of anthrax, we will give penicillin antibiotics. So next question says that they used some water from the well and which has caused some problems for them. So why the water of well has caused problems for the baby? For the they used water with the baby's formula of milk. So what problem has caused by the well water which is used from the well? Nitrite intoxication. Next is, the patient is irritable and anxious. Sir, give him nicotine and move on. However, this is not the typical nicotine which the general population of our youngsters are abusing. This is not that nicotinic acid, but we are trying to make some sense here, sir, so that you remember with the mnemonics everything. The patient is irritated and anxious, give him nicotinic acid and move on. Next is the case over rheumatism. So we have to medically indicate it, terminate the pregnancy. In cases of syphilis, you will do what? So we will do artificial termination of the pregnancy after antisyphilitic therapy. Sir, in rheumatism, we will do what? We will terminate the pregnancy directly. Medically indicated termination of the pregnancy. Very well highlighted, guys. I want you to mark this option correctly even when you are preparing it on the test center, please. Alzheimer disease, which we have covered already, in which the patient forget to get home or forgets the way to get back home. Next is the case over gout. So remember that when the gout and esophageal cancer are given in the question, it is asking about the gout and esophageal cancer cases are increased in an area. So what pollutant would have caused this condition? Sir, molybdenum will cause the gout. Okay, there are a lot of things to remember in this video. Please keeps on highlighting for yourself again and again that the better way is to recall also that by just watching the video you are understanding and making some sense, but when you will recall the information, sir, it will be stored in the long term memories of yourself. So remember, in the cases of gout and esophageal cancer, what pollutant caused this? Molybdenum. The main activity of dust aerosol is D for dust, D for dispersion. All right. Another case over they used some water from the well. Which intoxication? Sir, nitrates. We talked about it. Next question says that high dust concentration 200 mg in some factory. So, sir, and also, okay, I remember now. I have covered this question in some different portion. Sir, fungi are given here, and this is pathogenic property of the dust. Which pathogenic properties of the dust has caused this allergy? Sir, allergenic property. We remember from your last video that when you talked about the immunoglobulins, in that question there was this case Aspergillus niger and mucor fungi. So what they caused is allergenic. So next question is, a 37-year-old attack of unconsciousness, dyspnea, heart rate disorder. Father of the patient died at 45 with similar symptoms. So objectively, heart rate is this, BP is this. On the heart, US shows ultrasound shows ejection fraction is 49, which is low here, and a significant myocardium thickening of the left ventricle and intraventricular septum. Sir, this is the case of what? Sir, this is the ventricular hypertrophy or myocardium thickening and intraventricular septum. So what will be the problem with the ventricular hypertrophy? Sir, the cardiac output will reduce. So they have also highlighted that ejection fraction is low here. So we want to control the beating system of the heart, which will be controlled by, this is the case of arrhythmia, right? Arrhythmia, when the heart is not beating well and good ejection fraction is not there, so heart is not beating well, we will give bisoprolol, all right, so which will correct the heartbeat. All right. Next is the case over ventricular fibrillation. So this is a patient with the acute MI, suddenly fell ill, lost consciousness, pulse and BP cannot be detected. ECG shows frequent irregular waves of varying shape and amplitude. Sir, you told that if it would be the case of arterial fibrillation, then the question will say that P waves problem, the problem with the P wave. But and when the problem is with the ventricles, it will say something about the QRS complex. But when nothing is given in the question, sir, you did not told us that what to mark in that question. So sir, remember about it. After the acute MI, we have studied what complication could occur. Dressler syndrome, which will be with the other profile, we have read about it. And another complication which you have to remember now is ventricular fibrillation. So what are these ECG waves? Frequent irregular waves of varying shape and amplitude. So this is the complication named ventricular fibrillation. Next is the case over acute pyelonephritis. We have covered it already. Hallmark finding is sharp pain in the small of his back, and you can see the blood findings. You can see urinalysis, proteins are there, leukocytes are there, and large amount of mucus is there. Sir, what caused it? Sir, a bacteria caused it. Next is the case about ECG shows tall and sharp T wave. You can read the whole profile, but the hallmark finding here is in next question is sharp T wave is hyperkalemia. This is all you need to remember for this question. However, you can read the whole case. So the complication of chicken pox is, why the chicken pox is so dangerous? Because it causes cerebral edema or cerebral ataxia. And what is ataxia? Ataxia is the problem with the coordination of the body that we have seen in the cases of multiple sclerosis as well, that the person will not be able to walk properly. So ataxia is what? The problem with the coordination. So chicken pox complication is cerebral bellar ataxia. Next is the case over obliterating endarteritis. We have covered this case already. Next is next is the case of acute pancreatitis. So what you are going to, how you are going to treat the pancreatitis? Sir, we will provide the pancreatin to the patient, which is also known as panzinorum furate. So remember that not always this pancreatin will be given in the bracket. You have to remember P for pancreatitis, P for pancreatin, and P for panzinorum furate. Next is the case. You can read the case by pausing the video. But the ECG shows low voltage of R waves. Sir, why the low voltage of R waves are there? Sir, because the myocardium is unable to pump effectively. The stronger contraction is not there through the heart system. So the myocardium is not pumping effectively. Sir, what would have occurred in the patient? Sir, myocarditis, the inflammation of the myocarditis. The history is given that 10 days ago the patient had fever, chills. What are they highlighting? Some infection. So after the case of some infection, the bacteria will affect what? The bacteria will catch the myocardium easily. So when the low voltage R waves are given in the question, it means problem with the myocardium layer, which is not able to pump effectively because of the myocarditis or inflammation. Next is the case over pandactylitis. So remember, the question first of all will ask you the form of paranecium, and a lot of option will be given. This paranecium, bone paranecium, that paranecium. So remember that the question is asking about paranecium, but this is the case of pandactylitis. So remember that this is something twisted given here, that we also called some of the paranecium just termed as pandactylitis. The hallmark finding here is the patient cannot bend its finger. So when the patient cannot bend its finger, problem with the dactylitis, right, which are our digits here. So problem with the digits or dactyly, so finger cannot bend, hence the case of pandactylitis. Next is our case, the patient will complain burning sensation in vulva and multiple vesicles, which are only seen in genital herpes infection. Sir, in syphilis also we see that there are some similar profile in the syphilis. No sir, in the cases of syphilis a little bit different profile will be given. But remember about this case, the burning sensation in vulva. I am highlighting it again and again that this burning sensation in vulva is the hallmark finding for the herpes infection. This multiple vesicles in the question is hallmark finding for genital herpes infection. Next is our patient over diffuse toxic goiter has developed some arterial hypertension now. So sir, what we are going to treat, patient with diffuse toxic goiter has ciliary arrhythmia now. So sir, in arrhythmia what will we give? Antiarrhythmic, which is one of them, which is propanol, right? The mercazolil was given in the question, that the patient is already taking this mercazolil for the diffuse toxic goiter. Now he developed ciliary arrhythmia, so what treatment will give? Sir, we will give antiarrhythmic drug, which is propanolol. And next is the case over, remember about systolic murmur is the problem with the aorta, diastolic murmur is the problem with the mitral stenosis. Next is our patient with the HIV having this and this pneumonia, so atiotropic drug. Sir, remember that when there is the case over HIV, then instead of some pneumonic drug, you are going to prescribe the cotrimixazole. Please remember about it. A lot of times friends have been doing it incorrect. Remember about it. The case of HIV with some pneumonia, atiotropic drug which you will give to the patient is cotrimixazole. So next patient says that he is having recurrent short-term disconnect to consciousness and did not respond to talking, look straight head and examination. Sir, the CT will be given in the question. Sir, a lot of things, lumbar puncture will be given in the question. When you will do CT? When there is sign of brain herniation is given in the question. Anisocoria is given in the question. All right. And here you will do what? Sir, the patient is looking straight head and not responding to talking. Some problem with the brain, right? So put the electrodes on his brain, which will be the minimal invasive procedure here, that we will check the electroencephalography. We will check the electrical activity of the brain, that if the signals are coming to the patient or not, because he is not responding to the talking. So remember that we want to check the electrical activity of the brain, that if the signals are coming, the signals are not coming to the body, because the patient is not responding to talking, right? Next question is, remember about the 6 o'clock position. When you see the patient in 6 o'clock position, you have to go with the acute paraproctitis, which is the inflammation of rectum. Next is Ewing sarcoma. We have covered it already. This is hallmark finding is onion-like lamellar. All right. Next is excess alcohol plus sea spiders. So, sir, the patient is having some hallucinations after too much of alcohol. What is this case, sir? This is the case of delirium tremor, that the alcohol abuse can cause delirium tremors. Next, we have covered already, sir, when the patient is having when the patient is taking NSAID, diclofenac sodium for 2 years. This is the case of tubulointerstitial nephritis. Next is adenovirus infection. So 8-year-old boy have fever, profuse nasal discharge, wet cough, oropharyngeal hyperemia, and palatine tonsil, eyelid edematous, conjunctivitis, submandibular, cervical, axillary lymph nodes are enlarged. Sir, in the cases of mononucleosis also the lymph nodes are enlarged. Yes, my dear, I know about that. I am aware about that. Just remember for this question, when the size is given, so this makes some differentiation with the questions which I have seen typically in the cases of mononucleosis. And because tonsillitis is also given here, and lymph node enlargement is also given here, I'm sure that you can mark incorrect. Yeah, mononucleosis you can mark. So that's why I'm trying to make some sense that lymph nodes are enlarged, and eyelid edema, conjunctivitis, lymph nodes enlargement, these are the profile of adenovirus. This is my friend explained me as well, that lymph nodes are enlarged. So eyelid edema, conjunctivitis, lymph nodes enlargement, this is the case of adenovirus. And this eyelid edematous. So as told by my friend as well, eyelids are when edematous. So remember about marking the adenovirus. This is something hallmark finding which you will not be given in the question of mononucleosis. Sir, eye edema will not be there in the cases of adenovirus infection. All right, so let's go next. Our next patient is saying that he was taking methylprednisolone, which is a corticosteroid, and now he is having some problems. So, what are the problems associated with long-term use of corticosteroids? Osteoporosis. What is the problem related to the NSAID abuse? Sir, tubulointerstitial nephritis. And a problem with the corticosteroid long-term use, sir, osteoporosis. All right. Next is the case about chronic diseases and abnormalities. They are studying about the in the social medicine. They are studying about the chronic disease and abnormalities. So, what type of morbidity they are studying? So, they are studying about chronic disease. They are studying about chronic pathologies. So, this is the case of pathological morbidity. The examiner want to hear it from you that they are studying about chronic disease and abnormality. So chronic disease are what? Pathology they are studying about. So this is pathological morbidity. Next patient says in the car accidents what has happened? The profuse hemorrhage with the bright red blood. How to stop this hemorrhage? Sir, on the neck when there is profuse hemorrhage, so this is the blood related to the artery because this is bright in nature. So arterial blood when flowing through the neck, the best way to operate is digital occlusion Mikulicz method. So you have to go through the digital examination. You may not be able to solve this problem by any other ways. All right, so remember about it. When in the car accident the profuse hemorrhage occurred through the neck and bright red start to flow, the blood bright red start to flow, remember you have to go with the digital occlusion and Mikulicz method. Next is that in the case of pulmonary tuberculosis, they prescribed streptomycin, they prescribed pyrazinamide, they prescribed all of the things related to the pulmonary tuberculosis. So sir, some complication has occurred in the patient which is reduced hearing and tinnitus. So what would have caused the side effect? This was the whole question. So sir, remember that streptomycin causes the hearing and tinnitus. Hearing, reduced hearing and tinnitus is caused by what? Streptomycin. One more thing to remember, when there is blood in the urine, sir, this is the side effect of rifampicin. It is not written here, I'll write somewhere else if required, but remember that streptomycin causes hearing loss and tinnitus. Sir, urine is in the blood is caused by rifampicin. So rifampicin causes what? Blood in the urine. All right, they are the side effects, friends. Next patient, okay, this is the question which my friend asked me just today in the morning. Sir, when the patient is taking mercazolil, this mg per day for Graves disease, 2 week after fever, sore throat, painful ulcers in the mouth, this and this has happened. So what would have happened in the patient is the leukocytes were given very low, sir. So leukocytes were given in this question were 1.1, which is very low, very severely. So whenever our patient is taking some antithyroid drugs, so always suspect about the development of agranulocytosis. So due to this agranulocytosis, our leukocytes in the patient got reduced to just 1.1. Normal number should be more than this, a lot more than this even. So next patient says that acute respiratory distress syndrome. Sir, what you are going to measure in the acute respiratory distress syndrome? Sir, we will check the respiratory index of the patient, which is also known as oxygenation index. So this parameter we will be able to know after measuring this parameter, respiratory index and oxygen index, we will be able to know the severity of the distress syndrome. All right, next is the mensuration retention for 3 years. 25-year-old says mensuration retention for 3 years. childbirth was complicated by profuse hemorrhage and this. Now the patient is having loss of hairs, and so sir, this is the case of Sheehan syndrome, which we have talked in gyno portion as well. So decreased production of gonadotropin will be a hallmark finding, because the problem with the pituitary would have been necrotized after this much of profuse hemorrhage in the patient during the last delivery. So pituitary got necrosis. This is what occurs in Sheehan syndrome, that the pituitary has necrotized now, which will not produce the any more hormones now. So gonadotropin is produced by pituitary. So decreased production of gonadotropin means pituitary is necrotized. This is the case of Sheehan syndrome. Next is the modern organization method, especially in situation when time and distance are cruciate. So telemedicine, sir, what is telemedicine? You says that it will save time and distance. Even the ambulance will be given in the question, so please don't mark ambulance. So telemedicine is something online consultation. This is also known as online consultation. The patient saves time and distance. The patient don't need to go anywhere. It saves the distance covered by the patient. It saves the time of the patient. So in crucial condition, even if the patient cannot wake up from his bed, he is not in the condition due to some severe thing, he can get some online help, yeah, through his phone, through his laptop. So telemedicine is something known as online consultation, so which will save your time and distance. Please do not mark ambulance and another emergency services in this question. The answer is telemedicine. Next is, we have seen the cases over hypoparathyroidism, that the Chauvet sign is positive and Turosio sign is positive in the cases of hypoparathyroidism. Next is a patient with 64th patient with the hepatic biliary cirrhosis. So what drug you will prescribe? Sir, we will prescribe a drug which will be effective in the cases of urate lowering agent type. So urate, when need to get lower, is ursodeoxycholic acid. Sir, in the case of hepatic biliary cirrhosis, we will prescribe to the patient ursodeoxycholic acid. About the pancreatic cancer, we have talked about it, that positive Courvoisier sign, which means the enlarged head of the pancreas, and due to which what is there, the gallbladder is tense, about to rupture. This much gall is there because the obstruction is with the pancreatic head. Next is the case over this to eliminate the side effects of heparin. So remember that if you want to reduce the side effect of heparin, what you need to give to the patient? The antidote, which is 1% solution of protamine sulfate. Sir, remember about it. Next is, after eating shrimps, the patient got itching, hyperemia, and erupted into vesicles. So why the shrimps? Sir, shrimps causes allergy, itching, edema, urticaria. So remember that the patient might be allergic to shrimps. So what he developed? Acute urticaria. How did they look like? Sir, they look like edematous itching rashes over the body of the patient. So next is the case over the esophagogastroduodenoscopy shows the atrophy of the fundic mucosa. What pathogenesis would have occurred? Sir, this is the atrophy of the fundic mucosa, and no other pathology is given in the question. So why the atrophy occurred in the fundic mucosa? Because of autoimmune, probably, because no other pathology is detected. So autoimmune, it is the process, which is the case of gastritis A, which is autoimmune type. A for gastritis A for autoimmune. So in the cases of gastritis A, what happens is, our system or our body or our immune system produces antibodies to the parietal cells of our gastro cells. So antibodies to parietal cells, what we will see? Atrophy of the fundic mucosa. Next is a polisher which works in the building factory and works with the what happened in the patient is numbness of fingers and pain, and a lot of things will be given in the question. So remember that P for polisher, P for pneumatic hammer disease, which is also known as vibration disease. You will see this disease in polisher as well. You will see in the patient who are using drills, or who are driller, or who is using drills or something, is vibrating in their working job or occupation. So remember that P for polisher, P for pneumatic hammer disease, which is also known as vibration disease. Next is in an industrial area, pollutant with the sulfur anhydride. So, sir, sulfur anhydride will cause what harmful effects? Joint harmful effects. And sulfur gas will cause what type of harmful effects? Sir, sulfur gas will cause chronic non-specific type of effects. So remember about it, when only sulfur anhydride is given in the question, the effect will be joint. When sulfur gas is given in the question, chronic non-specific effects. All right, the effect of manganese, you know, forced laughter, and manganese effect are what? Complex. And one more thing, age is what factor? Uncontrolled endogenous. Cadmium causes what disease? Itai disease. Remember about it, I've talked in a lot of videos about this. Next is the case over colpitis or trichophytosis, colpitis or capitis. So this is a scalp ringworm. What is the cause of this condition? Sir, trichophyton SPP. This is fungal infection. Sign is, what sign we will see? Oval pink red patches, oval pink red patches and broken hairs. And what we will see in the patient? Wood's lamp, which is no green flow. Treatment, sir, this is a fungal infection. We will give antifungal. So this is GRISEOFULVIN. Remember with the spelling itself, you will remember it, that a scalp ringworm, capitis, trichophytosis capitis, scalp ringworm, and the broken hair are there, and oval pink red patches are there given in the question. And so what treatment you will give to the patient? Sir, glyceofulvin. Glyceofulvin. Some things to remember, guys. The choice of drugs we can just remember, right? This is the choice of antifungal treatment in the cases of capitis. So what you will give to the patient? Sir, glyceofulvin. How to give it? 20 to 25 mg per kg per day. Next, the case over. What happens is, sir, come directly to the objectively. Sharp pain, a sharp tension of the muscle in the anterior abdominal wall, positive Blumberg. Sir, positive Blumberg. I'll try to give you all the signs of peritoneal irritation together. However, Blumberg sign is not direct sign of peritoneal irritation, but it can be positive in the cases of peritoneal irritation. So peritoneal irritation is there. Sir, more signs are given. Sir, just remember that Blumberg sign is can also cause peritoneal irritation. The hallmark finding in this question is hepatic dullness, guys. So you have to remember about hepatic dullness. Sir, liver dullness, when we do percussion over the right subcostal region, we see dullness due to liver in that portion. When the dullness is not there, then what is there? Sir, air could be there. Sir, why the air is there and hepatic dullness is absent? So free air under the diaphragm. Sir, why the air has come there? Because the duodenal ulcer would have got perforated. So remember about this case, hepatic dullness absent means free air under the diaphragm, which is caused by the perforated ulcer. Next is our patient with the positive Keher, positive Murphy, positive Warner's. These signs are the signs for the gallbladder things, or anything with the gallbladder inflammation, cholecystitis or cholelithiasis or something like that. Just to remember, Keher, Murphy and Warner are the signs related to the right subcostal region pain. Sir, the no contraction of gallbladder. Sir, the contraction is not there in the gallbladder. So what is this case? Sir, hypokinetic biliary dikinesis, because the bile is not able to get out from the gallbladder and not reaching to the wherever it should reach, right? So the patient also complains about the dull pain in the right subcostal area. So remember that when there is no contraction with the gallbladder, so the kinesia, what will be the kinesia of biliary? Kinesia means speed. So speed will be hypokinetic. So kinesia is speed and speed will be hypokinetic, right? And what is the pathology related? Sir, speed of bile is reduced. So speed of bile is reduced. What case is this? Sir, hypokinetic biliary dyskinesia. Make sense? Yeah. So next is our eye gland in problem. Sir, this the question says discomfort during reading, redness on the edges of eyes, white foamy discharge in the corners or with this and this fissures. So this white foamy discharge, discomfort during reading, and redness in the edges, thickening of the loose eyelid margins, widened excretory ducts of the glands in the eyelid cartilage. So when they talked about the gland already, so what problem would have occurred? Sir, this is our main gland in the eyes: me bo mian bli far right. This has happened in the patient, that the meibomian gland, which is responsible for tear secretion, sir, some sort of fluid it secretes. So now what fluids are getting secreted in the patient, sir? White foamy discharge and discomfort during reading and all, because eye moisture is altered in the patient. So when the question is talking about gland, so what gland is problematic when the patient cannot read, when the patient has redness in the eyes? Do not mug up with the conjunctivitis. When the question says the white foamy discharge and this all pathologies are related to which gland? Meibomian gland, sir. So the inflammation has occurred in the patient. Next is repeated question. Acute intoxication caused by organophosphorus pesticide is decreased cholesterol levels. Next is the case over the 37-year-old acute attack of unconsciousness, dyspnea, physical examination says sensation in the heart rate disorder. Father died. I think we've seen this question. This is repeated question. You can read the question again, guys. That the problem with the left ventricle and intraventricular septum develops the problem with the arrhythmia, or let's say the heartbeat. It will change the heartbeat because the ventricle cannot pump effectively. So what you will give first line treatment, sir? Sir, we will give beta blocker in order to correct the heart rate of the patient. Next is the question over pyelonephritis. So what you will see in the patient? Dull pain you will see in the lower back. Yeah, dull pain or lower back. History is given, sir. 10 years ago during the pregnancy, the pain attack has happened in the right lumbar region with fever, more on the right. So sir, okay, let's read it out. So first rule out that it is the case of pyelonephritis. But sir, urinalysis shows protein which is mild. Okay, leukocytes are there which is mild, erythrocytes are there which is mild. All right, sir. Dull pain with this and this mild urinalysis, sir. What is the cause here, sir? Bacteria is the cause here. This is the case of pyelonephritis. But my dear, please do not forget to read the history here. 10 years ago, this and this pain attack in the lumbar right is also highlighting the pyelonephritis, right? So pyelonephritis the patient was already having. Please read the question carefully, and this is the case of not acute pyelonephritis. This is the case of chronic. So 10 years ago she had already pyelonephritis. So this time it is what? This time it is chronic version. So let's go next. Next is sir, just about such questions: acute ascending thrombophlebitis or venous vein in the leg. Sir, just tell us the hallmark, please. We are tired of such questions. Sir, let's see the hallmark now. When the onset of the disease is acute, let's say given in the question 2 days ago. Sir, when the acute onset is given in the question, mark thrombophlebitis. However, you have to remember for this question is that option correct was acute ascending thrombophlebitis of the venous vein in the legs. And when the chronic onset is there, the patient is having this and this subcutaneous varicose vein and blah 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 from 5 years, then this is the chronic case. So in the chronic case, what you will mark the answer? Subcutaneous varicose vein or something like this in the option. So when acute onset is given like 2 days ago, what you will mark? Thrombophlebitis. When chronic in onset is given, for example 5 years or something like that, what you will mark? So we will mark venous varicose vein or something like this in the option. Next is the question over patent ductal arteriosis. Let's come to the ECG findings directly. ECG shows left ventricular hypertrophy. It means there is the workload of the left ventricular has increased, right? X-ray shows intensified pulmonary pattern pattern and bulging of pulmonary artery. Sir, why the pulmonary artery will be bulged up? Because the pressure is high, because more blood is coming there, right? So why the ECG, as you can see with the photo itself, what happened is the right ventricular got hypertrophy. So due to hypertrophy, it is pumping more blood to the right ventricle, and the pulmonary artery got bulged up because left ventricle is pumping more blood to the right ventricle, and this is the case of pulmonary hypertension. So when you will see high pressure in the pulmonary artery, this is pulmonary hypertension. What you will hear from the question sometimes, the this and this sound is s2 is accentuated over the pulmonary artery. This is not given in this question, but sometimes you just so you know that in the cases of pulmonary hypertension, the s2 will be accentuated over pulmonary artery, and in the cases of aortic hypertension, the s2 will be accentuated over the pulmonary or the aorta, sorry. So this is the case of patent ductus arteriosus, sir. While the bulging is shown in the question, because more blood is coming to the right ventricular from the left ventricular. And how do we call it, sir? Patent ductus arteriosus. Next is the case about derealization. There is a separate video over that. Next is vesicles. We have seen in the molar pregnancy before. Takayasu we have covered already. Yeah, next is the case over the a 62-year-old showing retrosternal pain not relieved by nitroglycerin, suffers from angina pectoris previously. Now the ECG shows what? ST elevation. Sir, what occurred in the patient when ST elevation is there? Sir, this is the case of myocardial infarction, anterior STEMI. So what thrombolytic therapy which you will give to the patient? So the thrombolytic therapy which will be given to the patient must dissolve the clots causing blockage in the coronary arteries. What drug we will give to the patient? Sir, alteplase. Sir, actylize and alteplase. Please remember about this. These are the KROK's drug of choice which the examiner want to hear from you. So when the case with the retrosternal pain, angina pectoris plus MI, what you will give? Sir, alteplase will give to the patient. Multiple myeloma we have talked already. Benz-Jones proteins. About next case, yeah, 85th patient, 14-year-old girl saying chronic glomerulonephritis and chronic kidney failure. So problem with the kidney are chronic already in the 14-year-old girl. Sir, what the question is asking, the main problem in the patient is anemic syndrome, sir. This is given here in the right one, that anemia is there, a severe anemia is there, sir. What to do with the patient? Sir, give the drug erythropoietin. What it will do is it will increase the red blood cell production naturally by this drug. So it is released by kidney. So in the cases of chronic kidney disease, the kidney function is decreased and the kidneys are not able to secrete this erythropoietin hormone. So to increase the RBC production in the girl's anemic syndrome, we have to give her the drug erythropoietin artificially, so that it will increase the RBC production. Next is correlation coefficient. We have read about it in the social medicine. These beds are done. And next is the hallmark finding for pulmonary thromboembolism. Maybe you have forgot about the question. I marked it incorrect, so I tried to include it here as well. So edema in the lower leg is the case of DVT, sir. The question will not say DVT to you directly in the cases of thromboembolism of pulmonary system. So when the edema in the lower leg is given, please understand that the question want to highlight the DVT. Hallmark finding for pulmonary thromboembolism here is the BP is severely low, the patient profile is sudden, severe, and ECG shows S1, Q3, T3. So this is hallmark finding related to the thromboembolism. Full question is given in the video for the thromboembolism. Next is, sir, there was a third day after the primary surgical debridement of this gunshot wound. Yes, exactly. So sir, in the management portion, I was trying to remember that what another question is over the gunshot. So we got it here. Remember in the question in the management portion, what did we do with the gunshot? Sir, we removed it followed by the suction. And here the question says is bursting pain last 5 years. The muscle resemble the boiled meat. Sir, boiled meat when given in the question, what is this case? Tell us please. Sir, this is the case of anaerobic infection, that the gunshot wound will look later like a boiled meat. So this is the case of anaerobic infection. Heart rate is given 240, and the problem highlighted is P wave overlaps with T wave and deforms it. Sir, problem with the P waves, what is the problem? First of all, problem with the arteria. Then QRS without changes, no problem with the ventricles. So we have read about it that in the cases of arterial tachycardia or arterial fibrillation, the heart rate, let's say in the cases of arterial fibrillation, the heart rate will be some 150 to not 240, 150, 160, like that in the cases of arterial fibrillation. However, you can remember about from the video itself, the arterial fibrillation is a different topic. I have covered it in a separate video. But remember here guys, P wave overlaps with T waves and deforms it, and tachycardia is given 240, problem with the arteria, paroxysmal arterial tachycardia. All right. Next is the case over to pseudomembranous colitis. We have done it already. What you will find as a hallmark, pale yellow coating in the proctosigmoidography. Next case is this is important case, something when the question doesn't make sense to you. So also there are the cases of hepatitis A infection. Let's hear it from the patient. That 22-year-old patient, general weakness, difficulty breathing through nose, pain in the epigastrium, nausea, dark brown urine. So this is only the hallmark finding we can find here, that dark brown urine is caused by what? Dark brown urine is caused by the this is the case of jaundice. So this is caused by the bilirubin. All right. So onset is 4 days ago. Sir, on the 4 this is the profile only highlighting about the viral hepatitis A. Maybe if I get enough time, I'll try to cover the infections in detail, but just the important version first. So, sir, in the cases of viral hepatitis A, it will start with the fever, but on the 4th day, the fever reduces. We talked about it before also in some question, that on the 4th day, the fever reduced and these symptoms has occurred. So, sir, onset 4 days ago and fever is there. So, dark brown urine is there due to bilirubin. Suspect viral hepatitis A. All right. Next is our favorite question, whether to replace the pacemaker or urgent cardioversion is given. So we have talked about it. When the bad condition of the patient are given, when the unstable patient is there, so first do the urgent electrical cardioversion. It will, so because the patient has severe hypotension and severe tachycardia. So in such cases, what we are going to do is urgent electrical cardioversion. Next is our what parameter of water quality is most informative, indicates fresh contamination of water with the organic substances. So remember, in the cases of well also we talked about some nitrites. In the water quality parameters here, what we will talk about in the organic substances, sir, ammonia. So remember, nitrates, ammonia with the water quality, what are the main problems, sir? Ammonia, nitrate, and all of those things which will be given in the question. So in the when they take water from the well, what is this intoxication? This is nitrite intoxication. When the problem is with the organic substances, what is this problem? This is the problem with the ammonia, or ammonia poisoning will occur in the patient due to poor water quality. Next is the case over the again the acute or thrombosis or thrombophlebitis. So this time in the case, when the Homan sign is positive, what does it mean, sir? Homan sign when there is positive, so it means the DVT of the or deep vein thrombosis. So Homan sign is here the hallmark finding, and also the patient underwent for left hemi lobectomy due to malignant tumor in the descending colon. This is not really related to this. So on the fourth day, the after the surgery, the pain and edema on the left shin. So pain and edema we see in the thromboembolism question as well. What the edema indicates? The DVT case, sir. Positive hormone sign is hallmark for DVT. So what happened in this case? In this case, acute post-operative thrombosis of deep vein in the left shin. So remember about it. Do not confuse it with the thrombophlebitis and all other cases. So what has happened here? The DVT, sir. So next question is asking about what is the stage of sepsis. So the question says that 35-year-old has sign of surgical sepsis caused by a carbuncle in the scapular region, which is a case of infection. Sepsis is a reaction to infection. So now they detected secondary purulent foci in the liver and the lungs. So what stage of sepsis is this? Sir, septicopyemia, because it's not the recovery stage yet. They still detected the secondary purulent foci in the liver and lung, which means that the infection and sepsis still persisting in the septicopyemic stage. All right. And next is the same case which we have discussed already, that the child with the 4-month-old showing the auscultations like numerous wet fine crackles, sibilant visions during the exhalation is the case for the acute bronchiolitis. Next is, sir, a 3-month-old child formula fed 2.5 months since child's mother has no milk. Persistent redness in skin for 3-4 days later, itching, hyperemic skin patches on the cheek and chin, patches filled with serous exudate that forms the yellowish scab when dried out. Seborrheic scales are observed on the child's scalp. So when the question says serous exudate are found, so sir, what type of diathesis this is? Sir, when exudates or serous exudates that are formed in yellowish scabs when dried out, this is the case of exudative cathedral diathesis. Next is the patient. Next patient says that, a lot of histories that he has 19-year-old hit his head on the bottom of the pool, complains about the pain in the neck, head movements are limited and painful, and the examination shows head bowed forward on to the right and the supports with the head. Palpation detect tense neck muscle, protruding spinous process. So and the C4 vertebral cervical vertebrae. So when pressure is applied to this process and to the head axial load, the pain intensifies because vertebral fracture is there. So you know from the question that vertebral fracture is there, as they have highlighted this spinous process in the C4 level of the cervical vertebrae as well. So sir, what confusion will occur in the question is the fracture is complicated or the fracture is uncomplicated. So the fracture is uncomplicated because there are no neurological symptoms there. There is nothing related to the consciousness, bloody CSF or anything. No, nothing is given about the complication of the cervical fracture. So this fracture is uncomplicated cervical fracture. That is without spinal cord damage. That's if the spinal cord damages, then we will see neural symptoms in the patient. Next case we have done that if frequent urination, painful urination in small portion, urinary incontinence, this much problem with the urination. So problem with the urinary bladder, which is inflammation, which is cystitis. Next is the case over syringomyelia. We have covered it already. The hallmark finding is loss of thermal sensitivity, that the patient received such burn that he could not that takes him long time to heal. We have covered it in different portion. In the rheumatoid arthritis, what cells you will see in the patient? You will see, sir, rhagocytes. R for rheumatoid arthritis and R for rhagocytes. Please remember about it. How we will disinfect the water? Sir, we will do hyperchlorination. Please remember that in the option you will be given chlorination, double chlorination and hyperchlorination. Sir, please remember, I have write the chlorine here in my notes this many times, so that you remember that the answer is not chlorination, not double chlorination. The answer is hyperchlorination. Please remember about this. In some question they were asking about the traumatic shock degrees. Sir, here are the traumatic shock degrees. If the diastolic BP is 60, it's the case of traumatic shock degree 2. First will be 70 degree 1, 60 will be degree 2. So please remember about this. And for the KROK question, most of the time the answer to the traumatic shock is degree 2. Next patient is acute conjunctivitis. Shows so conjunctivitis, sir, what is this? This is the inflammation of the conjunctiva which will shows redness, swelling, burning, foreign body sensation and discharge in the patient. Let's hear it from our patient. That 32-year-old patient says about reddening, burning sensation in the foreign body in the right eye, acute onset, and right eye hyperemic swelling of the conjunctiva. So swelling of the conjunctiva, what is the case, sir? Conjunctivitis, the inflammation of the conjunctiva. Purulent discharges are given in the question. It means the purulent conjunctivitis, it is caused by some bacteria. So inflammation can be caused by bacteria. So here the case is clear. Sir, you have seen the other case with me. The other case was before the trichomonas colpitis. I wanted to highlight one more time so that you will remember it for sure, that in the cases of trichophytosis capitis, please do not mug up both of these things. Trichophytosis capitis is a scalp ringworm in which the treatment we give is antifungal, which is griseofulvin. This is the case of trichomonas colpitis, sir. Trichomonas colpitis, the question will scream to you. In my first video also I have highlighted what the question will scream to you. In the cases of trichomonas colpitis, sir, discharge is profuse, discharge is foul smelling, so discharge is foamy, so there is burning and itching in the genitals. Sir, she has no regular sexual partners, she is prone to infections related to the lower urinary tract. So remember about the profile of trichomonas. Discharge will be profuse, foul smelling and foamy. The patient will complain of burning and itching. So you said that there will be burning and itching in the genital herpes infection as well. Sir, you have to remember that the herpes or genital herpes infection will give you a different profile, which is there will be burning and itching over the genital, plus what will be there, multiple vesicle will be there. And the question didn't really said about the discharges in the question of genital herpes infection, but here the question is saying about the discharges. The most highlighting thing is discharge here in trichomonas colpitis. So next is our patient 107. So next of our patient says he was taking metformin. So metformin metformin is doing what? Metabolic acidosis and hence the kidney problem. So when the patient is taking metformin, so always check what while prescribing metformin, sir. Always check the calculation of glomerular filtration rate, because metformin can cause metabolic acidosis and hence some problem with the kidney. So if you are prescribing metformin to the patient, first check the glomerular filtration rate of the patient and then only prescribe the metformin, ruling out the risk of kidney problems. Next is cadmium level. We know itai disease. Next is mother's belly is ovoid, baby lie in the longitudinal position, which is first position back on the left, presentation head is up, which is the breech position. Head is up and buttocks are lower, which presentation is that? Breech position is there. So head is up and firm bloating part at the uterine fundus. So this is when the mother's baby is ovoid and baby lie in the first position. So first position is which one? So first position is longitudinal lie. So remember about this question. We have also marked it a lot of times. Me and my friends also marked it incorrect a lot of times. Please understand it finally, or please learn it finally, that not a lot of questions are there related to this position. So the baby is in the longitudinal lie, position 1, breech presentation. Next is the patient. Our patient is complaining about irritability, tearfulness, unmotivated mood swings, finger tremor, rapid fatigability, and irregular menstrual cycle, pigmentation around the eyes, weight loss 10 kg. So if the weight loss is there, the case is for the hyperthyroidism, right? So objectively, heart rate is this, BP is this, thyroid. What we needed in the question, thyroid. Weight loss is there, we are supposed to already understand that this is the case of hyperthyroidism, sir. So thyroid is enlarged, painless, soft, elastic. So and these all signs are given. So these all signs are DSMV. I have wrote it. If you cannot remember, maybe take one hallmark from these signs. So these are DSMV. You can read about these signs. So what happens in the case? This is the case of thyrotoxicosis, because the patient is feeling a lot of symptoms are there which are marking the deterioration of the patient's condition in severity. So this is the case of thyroid storm, which is also known as thyrotoxicosis. What happens in the patient body is excess T3 and T4 in the bloodstream. So next case is a woman undergone surgery for diffuse toxic goiter degree 2. 12 hours after the surgery, she got hoarseness and voice loss, anxiety, problem with the breathing, and dyspnea. Post surgical wound is normal. What complication occurred in the patient? Sir, hoarse voice and voice loss. Sir, you told in the different portion that hoarse voice, when you see that the voice with the problem, or loud breathing when you see, so these are the problem related to the larynx, sir. So even in the cases of acute laryngeal stenosis, you will see such symptoms in the patient. So what complication has occurred in the patient? The recurrent laryngeal nerve paralysis. So if the nerve got paralysis, so the patient will not be able to speak properly, because our sound box is our larynx, yeah, and problem with the breathing because of some paralysis over there. So recurrent laryngeal nerve paralysis. Manganese effect, we know that this is complex, yeah. And next question says about the 40-year-old has a cough in the morning, mucopurulent sputum is there, temperature is raised over there, and smoking since 17-year-old. Sir, he is smoking from 17-year-old. So already understand that this could be the case of COPD, yeah. So COPD is not given in the question. So COPD is further divided into subdivisions under which chronic bronchitis is also covered. So auscultation detects coarse respiration and diffuse dry crackles, because some sort of fluid can be there. So bronchoscopy detect purulent cathedral endobronchitis. So sir, the patient is smoking since 17 years. He is a chronic smoker. So what will happen in the patient? Chronic bronchitis, because we see the bronchoscopy findings that what is there? Purulent cathedral endobronchitis. The inflammation of bronchioles is already highlighted by the examiner, but the examiner want to check what you will mark as answer, the acute or chronic. So sir, please remember, he is smoking since 17 years and now he is 40 years. The problem is already chronic. Let's see the next patient. Next is our chocolate colored sputum. We have talked about it, sir. Chocolate colored sputum is the case of gangrene. And in the cases of acute aniline intoxication, what you will give as an antidote? Sir, we will give methylene blue as an antidote. Next is sir, about the question over femoral hernia. Please hear to me carefully. This is something which you can mark wrong. So a 74-year-old woman says pain in the right inguinal region suddenly 2 hours ago plus 3 weeks ago, but disappear on lying down. So a Popart's ligament is sharply painful. Sir, when the Popart's ligament is sharply painful, this is the okay, first let's hear the this cuffing sign is negative. Sir, when the cuffing sign is negative, it means the inguinal hernia is not there. So you can rule out inguinal hernia already. So what was given in the question? Another other than the inguinal hernia, femoral hernia was given in the question. So below the Poupart ligament, it is sharply painful. So remember about it. If the hernia is direct or without strangulation, the sharp pain will not be there. There will be a little bit acute or lesser profile in the pain, lesser painful profile given in the question in the cases of direct femoral hernia. But when the Paupart's ligament is very sharply painful, sir, what would have happened? Sir, the hernia would have got strangulated, which is twisting around its own axis, which will cause severe ischemia and which will be sharply painful. So remember about the case of acquired strangulated femoral hernia. Next is the case over acute pyelonephritis. History given in the question is acute viral respiratory infection and low urine output, frequent urination, temperature is this and this, mild proteinuria, mild leukocyturia, plus highlighted bacteria plus highlighted mucus. Sir, we have seen this case. This is the profile related to pyelonephritis. Next is the case of urinary tract infection, so caused by E. coli or any another like pyelonephritis. Sir, what is the choice of antibiotic we are going to prescribe when the examiner is asking about the nephro problems? Sir, you are going to prescribe ciprofloxacin. Please remember it. This is a good antibiotic to cover up the nephro infection or UTI. So next patient had flame burns, gray brown, necrosis covered 3 by 4th of the body perimeter, occasionally have small blisters and hemorrhagic contents and patches of shed epidermis. Sir, local therapy what you will give? As told by our surgery teacher, we will do decompression necrotomy, but here it is the translation error. What is given by the examiner? Decompression nephrectomy, which is nothing but this is the translation error. What we will do is, sir, in order to rule out the risk of compartment syndrome, we will provide the nephrectomy. We will make the incisions over the burn because the area is swelled up during the burns of the patient. So remember about it. What you will do as a local therapy, sir, you will do decompression nephrectomy. And this is the case of what, sir? Something around between 3 to 4 degree burn is there. Next is the case over 120. Next is the case over 37-year-old had the shortness of breath and constricting retrosternal pain. 1 week ago had flu. So in the history, flu is given. Sir, when the infection is there or upper respiratory tract is there, just remember for the KROK question that now the infection will catch the myocardium of the patient. So infection is going to catch the myocardium of the patient. This is the case of infectious allergic myocarditis. Let's see some another findings. Cardiac border are extended to the left and right by 3 centimeters. So the case of cardiomegaly is there. Heart sounds are muffled, which is altered heart sound. Above the cardiac apex, the protodiastolic gallop rhythm plus systolic murmur is there. So this case is related to infectious allergic myocarditis. So remember, after the flu, the infection will spread till where? Sir, infection will catch the myocardium now and cause problem with the heart now. All right. Next is the case that 5-year-old girl complains of nocturnal incontinence in her child, night terrors, disturbed sleep, low weight gain. Girl is this and this, intellectual ability is well, can read, pale and liver enlarged. Mother suffer from cholelithiasis, type of diathesis. Sir, why neuroarthritic diathesis in this question? Let's hear it first. What is this? This is the constitutional anomaly with the nervous system hyperexcitability, that the nervous system will be highly excitable. So that's why the problem with the nervous system, the reflex for urination is coming from where? So the neural system. So the child is having night terrors, disturbed sleep, because it's hyperactivity of the neural system. Nocturnal incontinence. So everything is related to the neuro system here. Consider that the reflex is having problems. Any of the system is having problems, the neuro system. So neuroarthritic diathesis. And the highlight here is nocturnal incontinence, and the child is well developed. Child intellectual ability if well developed, if the child is performing very good in the school. So this is the case of constitutional anomaly with the nervous system hyperactivity. Next is something to remember: S for signs of savings, S for C, and S for vesicular, C savings, C vesicular. So please remember about it, something atypical which is good to remember if you can. So a non-inflammatory yellowish brown pale pink spots on the chest, neck and shoulders and the sides of torso. When the spots are scratched, the signs of shavings is observed, and the rash is first noticed after a summer vacation by the sea. So sir, signs of shavings, no rash noticed around the sea, the case of vesicular, please remember it. Or this is tinea vesicular or pityriasis vesicular, please remember. Shaving, C vesicular, please remember. This is something which is marked incorrect by all of us a lot of time. So let's go next is again the patient have a case of low voltage R waves. So remember that low voltage R waves, the okay, this is the repeated case, we have talked about it. Next is the case over intertrochanteric hip fracture. Suddenly the patient with the intertrochanteric hip fracture suddenly developed what? Dyspnea, pain in the left chest, distended cervical vein, cyanosis. Sir, this is the case of pulmonary embolism because sudden dyspnea and pain in the chest, distended cervical vein also shows the severity of the patient, and also the cyanosis is there. Respiratory rate is high, heart rate is high, BP is getting low. It is still not very low, but the BP is reducing, or the pulmonary embolism will show you very severely low BP because occlusion with the pulmonary artery. So what you will do, treatment tactics? Sir, prescribe the low molecular weight heparin for the betterment of the patient. Next, patient 125 suddenly fell ill and pain in the lumbar region, frequent urination and vomiting. You can read the whole question. Pain in the lumbar area, costovertebral angle tenderness, it means some stone can be over there, because the question of pain in the lumbar area frequent, so there is sudden pain over there. Sir, what can cause sudden pain? Sir, any stone can cause sudden pain. Costovertebral angle tenderness shows what? This is what? Pasternetsky sign, which is positive in the cases of renal colic as well. So costovertebral angle tenderness is thumping on the patient's backside on the costovertebral angle, and patient will report the pain. So pain on palpation of kidney along the ureter on the right. So remember, highlighting pain, or let's say radiating pain, or along the ureter pain, so sudden pain, these are the cases of renal colic. So urine test shows what? Fresh erythrocytes, leukocytes. So no bacteria is given here, right? No fever is given here. We will not mug up with the pyelonephritis and other type of infections. You told us that the pain is along the ureter, which is radiating type. Along means what? Radiating. Yeah, the pain is acute and sudden pain, and there are erythrocytes in the urine. So you told us that this is the profile for renal colic, so please mark renal colic. Last but least, let's say frequent stools. The patient is having 3 times a day, lumpy feces, large amount of mucus, abdominal pain and debates after defecation, irritability in the abdomen, moderately tender along the colon, palpation shows, fibrocystic colonoscopy shows no changes. So is it the case for the Crohn's or ulcerative? So the answer is no, because the fibrocystic colonoscopy shows no changes. Sir, in the cases of ulcerative and colon, what we are going to see is some changes with the mucosa, serosa, and some layers which I have covered in that other portion. So this is the case of frequent stools, means bowel movement changing, abdominal pain, irritability, moderately tender along the. So this is the case for irritable bowel syndrome. So Please remember it. No need to mark the ulcerative colitis or Crohn's syndrome in this question. All right. Dressler syndrome, we have talked about it already. This is modified. Okay, this is something good for you, good for your health, to calm down your brain before you watch the next video. Sir, this is what? Sir, this is modified deep breathing technique which I made for my friends so that they can calm down in any time. Sir, this is deep breathing. You all know what is deep breathing. Here is the modified version of deep breathing. This is my technique. So, as I understand, is pranayama according to the yoga is deep breathing as much as possible, like inhalation, then hold the breath as much as possible, and then exhale as slow as possible. So, we will perform just one round of deep breath with me in order to check the potency of my technique. Let's see that how useful is my technique. I suggest you to perform it with me for one round at least. So what we are going to do is we will inhale as much as possible. We will pause as or hold as much as possible, and then when we are done with holding, what we will do is we will exhale as slowly as possible. So let's start one round of this technique. Let's do it. Inhale deeply, hold as much as possible, hold, and when you are done with the holding, as slowly as possible, release from the mouth. Perform one more round at the same time itself and feel the benefits. So this is it with this video. I hope you enjoyed the video, and please take enough breaks from the study sessions. If there is some problem, let me know in the comments. So this is it. Have a nice day and see you in the next video.